Have a look at this clinical question. I'll stop you there. So much bigger spread of answers now. So B, C, and D. So starting Montelukast, doing a trial of moderate dose steroid, or referring to a specialist for respiratory pediatrician. All three of these were very popular. This one slightly more so, but these two are very close behind. Okay. So what we've got in this scenario is slightly different. You've got someone who been to the hospital 3 different times in a 1-year period because they've been wheezy, and they've been put on a trial. Remember, we used the trial in this age group as a diagnostic test. So they've had a trial for 12 weeks of pediatric low-dose steroids, but look at this. Their symptoms didn't improve at all. There's no obvious triggers. There's nothing else that we can think that fits. So the correct answer, according to the guideline here, is to refer to a specialist respiratory pediatrician. And that's because we basically don't have an explanation if we can't think of another diagnosis apart from asthma, yet they haven't responded to steroids. We've got diagnostic uncertainty. They're going to need a specialist workup by an asthma specialist to come up with what is the actual diagnosis. So that's why it's D. So now let's go through the guideline for under 5s. So you've got someone under 5. Remember, you can't do those objective tests like FeNO, like spirometry, like the methacholine or histamine challenge and so on in this age group. So if you've got someone with suspected asthma and they've got symptoms, they're getting really wheezy, they're getting short of breath, maybe they're having nighttime cough, things like that, or they're getting severe acute attacks, ending up in hospital. As a diagnostic tool, you basically put them on a trial of pediatric low-dose steroid, at least 8 weeks, up to 12 weeks. If their symptoms don't improve, check are they using the inhaler properly. In this age group, it'd be the parents giving it generally with a spacer. Check the environment. Could there be a trigger causing, some kind of other allergic type reaction? What's going on? Consider any other differentials. If there isn't anything else that comes out, then we don't have an explanation for why the treatment has failed. So you'd refer to an asthma specialist. You see, that was this last patient. We'll go down this pathway. Whereas if their symptoms resolve, then your diagnosis is basically confirmed that, okay, we've got someone here, this fits with asthma. All right. So you'd consider actually stopping after the trial period to see how do they get on now that we've confirmed they've got asthma, but we're not putting them on any regular treatment. And if their symptoms start coming back or they get even one severe acute attack, you basically say, okay, they need long-term maintenance treatment for their asthma. So you put them on a pediatric low-dose steroid. And alongside that, they have SABA, so salbutamol, which they take on a PRN basis. So this they're taking every day, a brown inhaler, pediatric low-dose steroid. Take this every day, morning and evening. If you get short of breath, take some extra puffs of your blue inhaler, the salbutamol, okay? And you just keep monitoring how they're getting on. You might titrate up to pediatric moderate dose steroid, all right? And if they, depending on how they get on, you might then consider a trial without treatment. Let's say, they're on low dose, their symptoms sort of clear up completely. You reviewing them every few months, 6 months in, you think, they're doing really well. Well, let's try a trial again without treatment and see what happens. If they're, okay, you might then step down. They might just stay on a SABA. If they're not well controlled, or if they're on treatment, they're taking it regularly, and they're still not well controlled, you've gone from low dose to moderate, then the next step is to add in a leukotriene as well. So they'll be on a pediatric moderate dose by now, and you put them on a leukotriene, so montelukast, and then they've still got the SABA, the salbutamol, to use PRN. That's there alongside, okay? If it's still not controlled after that, you'd stop the leukotriene and refer them to an asthma specialist. So for under fives, it's relatively straightforward, okay? Hope you found that helpful. Please do subscribe to the channel, like and share with your colleagues if you'd like more content.